Welcome and thank you for viewing this presentation on HCI Active's COVID-19 Return to School Support Solution. We prepared a brief overview of this solution, which should be just about 10 minutes, followed by a demonstration of the key functionality of portals which can be made available to staff and parents. After this presentation, we encourage you to connect with your solution advisor to begin tailoring this solution for your organization. HCI Active is the leading platform for digital benefit and insurance policy administration, recognized by CIO Review as one of the most promising insurtech solution providers in the market today. We enable organizations to achieve greater consumer intimacy and loyalty with consumer-centric plan design and experiences. We streamline administrative processes by utilizing intelligent ecosystem automation across entire organizations. And we offer operational agility and the rapid ability to scale and grow to meet the needs of each business. In this presentation, we'll cover our COVID-19 Return to School Support Program, which is structured to provide turnkey tools and resources that will assist educators in meeting the challenges of reopening and staying open. This program is built on 3 pillars: tracking disease with our daily symptom screening and contact tracing tools, training staff with digital education and support, and testing for COVID-19 via an array of solutions tailored for each organization's needs. What are the health-related challenges for educators? Number 1, we must protect students, staff, and our schools. Number 2, confidentially screen for symptoms and continuously monitor results. Number 3, protect privacy. Number 4, align with CDC guidelines and recommendations. And number 5, optionally integrate with COVID-19 testing where needed. How do we meet this moment? We're going to implement a platform to track, train, and test all students and staff. We're going to utilize an easy-to-use digital symptom screener that students, parents, guardians, and staff will complete daily prior to entering school. We're going to obtain HIPAA consent to engage and monitor confidentially and compliantly. We're going to align program processes to CDC recommendations and leading practices and manage student and staff program information via a real-time return-to-school program reporting dashboard. And we're going to test students and staff efficiently and easily and report all the test results on the program platform. This is a new product, and it has 8 major phases. The first, onboarding a census to the system. Second, opting in each participant via the digital system. Third, unifying training of individuals to stem the spread of COVID-19. Fourth, track participants in the system with a system screener. And fifth, manage testing. If a symptom surfaces or a person tests positive, quarantine can then be recommended. We can then contact trace using the system to identify close contacts, if any, and recommend they quarantine. The system calculates the time spent in quarantine behind the scenes and can also collect return to school or doctor's note releases from medical providers. So clients can use the system to approve people to return to school, all tracked and incentivized to achieve success over this disease, with built-in engagement to drive participation and seamlessly connect to the overall enterprise. This is available now. It can be launched quickly with engaging materials and an easy-to-implement solution. Deploy mobile and web interfaces connect to a single administrative system. Leverage an easy-to-use report dashboard providing real-time business intelligence. Take total command of shared spaces by offering a complete solution. Synchronize efforts with public health guidelines to keep COVID-19 out of shared spaces. And tailor tracking, tracing, testing, and more to meet your organization's needs. The base module has 2 parts. A tracking tool we call the Symptom Screener, developed based on CDC guidelines to have everyone self-attest to their symptom status before each school day. And second, a training component where the provisions of relevant educational resources are packaged, incentivized, and ready to deploy. This suite also has a virtually unlimited array of the latest and best optional testing add-ons to detect current or past COVID-19 cases. Digging a little deeper, the Track module, which everyone sees on their portal as the COVID-19 Symptom Screener, is a set of quick-to-complete symptom screening questions we derive from CDC guidelines. Each individual will complete this daily before reporting to school. Parents will do this for their students, and teachers and staff will complete this before showing up at the school. If anyone reports a fever, shortness of breath, or any of answers yes to any of the screening questions, they're directed to quarantine, seek primary care, contact their supervisor, and do other things as guided by the system. The system will also notify administrators as well. Now, if a person reports no symptoms and answers, no to all the questions, they'll receive a success message and they're ready to appear at work. And these kind of things can be integrated with other on-site screening, such as staff that are asking screening questions or manually taking temperatures or automated devices to collect temperatures. But the importance of this is you've got a self-attestation from either the parent or the staff that either the student or the employee is ready to be in the location and is symptom-free. On the training module, digging a little bit deeper, this works to really separate fact from fiction. There is so much information about this virus and how to avoid it, and we are constantly updating to stay in tune with the latest information so that people have the leading practices based on these guidelines to protect themselves and others from COVID-19 as well as infectious diseases generally. And then we use our incentive workflow automation engine to guide people through each of the required steps for the voluntary online education modules and digital health coaching, which they can all complete on their own pace. It's self-paced and via these digital interfaces. And finally, testing as overview. This, as mentioned before, optionally, we have a virtually unlimited array of the latest and best optional testing add-ons to detect current virus or past infection of COVID-19. When an organization elects testing, the platform is used to screen participants and schedule them for testing. This testing is occurring on site, and with our scheduler, we can manage the number of individuals appearing for testing at any one time to stay consistent with social distancing guidelines that you've implemented. Once a test is collected and processed, the platform can also be used to ensure that the individual and the administrators and any other connected departments are properly notified, and everything is coming very quickly and being managed completely. Part of that is all happening via our client portal. Behind the scenes, administrators can take complete command of their program, which allows them to manage participants as well as access powerful business intelligence to manage program performance and monitor their workforce to stem the spread of COVID-19. That takes place with engaging reports where administrators have the ability to filter and customize data amongst different subgroups and populations to better interpret what is happening on demand. HCI Active's COVID-19 solutions enable organizations to launch complete programs quickly. With this program, we really have two main groups, the staff of a school as well as the parents and students at that school. So the minute the contract is initiated, we can begin really, once we've got a logo and a name and some basic options and a census, the system can be launched very quickly and begin to educate your staff and schedule testing while you're preparing for the launch to the students or connecting with their parents to do that. So as you're getting that communication out to the parents, your staff can be connected right away. So that by 2 weeks post-launch, we're already in a position to start testing staff, and they have gone through the educational modules, and that really by within about 3 to 4 weeks, the administrative staff is ready to go, tested, and have full control over the school environment, so that as this rolls out to the parents and the students, all the administrators are ready. And so when you go live, you've got a very well-organized, understood program, and you're prepared for those parents to be performing that daily symptom screening and reporting whenever there are symptoms that are occurring and having those kids stay home so that everybody who's coming on site has been properly screened and supported, and so that right off the bat, once your program's launched, you're in a position to be have full view of your organization and be continuously improving and adapting as needed to stay open. The great thing is there's a lot of detail to this program, but it's ready to market. It's easy to launch. There are co-brandable materials prepared for schools to begin the process of communicating with parents as well as then the staff. And we have made the launch as simple as possible so an organization can get up and running as fast as possible. So with that, I'm going to jump really to the heart of the program, which is the system to administer and manage everything happening around COVID-19 and control and protect your environment. So I've set up some things here that I'm going to jump over to. The first of which is this document, which is an outline that you will see in proposals made to your organization and will be attached to agreements. This is the primary. We use a lot of workflows in our system. This is the primary one, though, that we're using to administer processes around, keeping your environment safe. It starts with on the parent side, collecting a parent consent for each of their students, and we'll get into more details of that as we go through the demo. Then once we've got the consent, performing the symptom screener. If a parent marks no to all the questions, they'll be done for the day, and then they'll return to check in before the next day. If they should answer yes to any of the screenings, a quarantine will be recommended, and then they'll be directed to provide any close contacts, and you'll be seeing that in the demo. Once they have completed the simple, easy-to-use contact tracing form, they'll then be reminded to contact a medical provider and to follow up. And in some instances, that medical provider may return a note so the student can return to school, and the system can be used to upload that note and those details so that gets back to the administrator quickly so that the parent and student do not have to wait very long to return to school. But the minute that that's approved, they can then return to school, which is the whole focus of this program, is that we delay any, people spend time in, the individuals spend time in quarantine when they need to, but when they don't, they minimize that time and they can get back, return to school. Over here, I've got our portal environment. This is customized for each individual situation. This is showing a parent view where they're going to they're going to manage their students. In this K-12 environment, nearly all the students are under the age of 18. A parent must provide consent. Even in that limited instance where a student may have turned to 18, for uniformity and ease of administration, we're still going to ask for parental or guardian consent, and that this be managed by a adult. And so down the left side here are some of the tabs. We're really going to be focused on the symptom tracker one. You'll see when I give a preview of the staff version of this, these buttons will change. But to suffice it to say, these can be set really with anything that an organization needs. In this case, we have links to message and activity, the online education modules you talked about. We can also set up that optional testing and information about how they perform that. If your organization has special forms, documents, or other links, they can be here so we can direct people to whatever information they need. And as well, of course, like any kind of tool like this, the ability to manage settings and notifications, passwords, and such. But again, we're going to focus on this symptom tracker. Now for this, each student is treated individually. This is populated based upon census data that we'll receive from the schools and district. In a K-12 program, it is not uncommon that we will have students that are at different schools. Older brothers and sisters, maybe in high school, whereas younger brothers and sisters may be in a middle school or elementary. They'll all be listed here. Each student is treated individually. They will come through this and need to opt in to the program. There's some basic information reminding them that this was developed using guidelines from the CDC, and it gives them a preview of the main things to expect, that it's component of education and tracking. When just prior to this, they'll get a program disclosure screen, and they will be suggested that they download and open the disclosure document. With what we're doing here, this logo can be branded for the organization. It has the parent's name, the student's name, and really what we're trying to do here is both educate the parent as well as have full transparency, and also really emphasize that what we're doing here is collecting the minimum amount of information to make sure everyone stays safe. And so we want parents to know exactly what they're agreeing to, what's happening, and how to best manage that so they can play an active role in protecting their student and the school that they attend, and also have comfort, that what they're doing is, they can feel good about the process they're participating in. Once they've read that, they'll come in here to digitally consent. It's important that we capture this for your organization. You'll have a record attached to that individual of when they provided their consent, and that'll be a record, to know that will be important for compliance and again, just make sure everybody knows where they stand. Now, what I'm showing on the screen is our symptom screener, and what you're seeing here is really a large list of symptoms that can be included in your symptom screening. But these are all configurable, and it is possible that you can configure this to have fewer questions. Many organizations will just focus on, if there is someone with COVID-19 in the home and whether they have had a fever and then the persistent cough. But this is, again, up to your organization, and we can discuss this specifically of what you have here. Generally, from day to day, people say no to all these. They will submit it. They'll get the confirmation that it's been received, and then that's all that they need to complete for the day. So it's very straightforward. And that's all they'll need to do. They just submit that, there's a record of it in the system, and then they're ready to attend school. Now, let's go through some of the exceptions of what can happen. I'm going to use the second student here, and let's look at, they've viewed the program, and they've looked at the release, but for whatever reason, the parent is not providing their consent, and they click no. When that happens, they're going to get the message, and that they're going to be informed that while they're not required to participate, their access to school facilities may be limited. And this is really where your organization will set its own policy for this, but your administrators will get a notification so they can then follow up with this parent to discuss what needs to be done, whether they'll change their mind and provide their consent to opt in, or whatever accommodation needs to happen. But for compliance reasons, you're going to want to make sure everybody, willingly opts into this program. Okay, now let's consider that it is the next day. And instead of having no symptoms, that there is now somebody in the home who has COVID-19, and the student is experiencing a fever. Otherwise, they're selecting no. When a parent selects one of the symptoms, yes, it will capture their symptom screening. However, it will recommend quarantine. Now, while only a medical provider can diagnose someone with COVID-19, the CDC is telling organizations to direct symptomatic people to self-quarantine until either cleared by a medical provider or a certain amount of time has passed, basically in self-isolation. This is directing them to immediately self-quarantine their student and have them avoid close contact with others. And as well, when a symptom is reported or a positive test is stored, an administrator will be notified. But we're still directing parents to notify the school attendance office and let them know that the student will not be attending, just to make sure that they know why the student's not going to be there. And then this is going to give a preview of what's going to happen in the system with having them report any close contacts and to follow up with a medical provider. Following our sheet over here, this, we've just completed the symptom screener. Now we're going to move to the contact tracing phase. So now this contact tracing, this is, whenever you hear contact tracing, it's often in the context of public health. You've got, often it's county or parish departments that are reaching out based upon a report received from a lab, a doctor, a hospital, to someone to identify who they've been in close contact with to get those folks to self-quarantine. Organizations will want to do this themselves as well. That process could be delayed by a day or a couple of days, but an organization to stem the spread of COVID-19, when they find out somebody has got symptoms or been received a positive test, they're going to want to have that individual provide their close contacts within that subpopulation at the school as quickly as possible, because the sooner those folks can isolate, the less likely you're going to have an outbreak of COVID within your facilities. So in this process, one of the things that's great about a system like this is that information can be submitted confidentially and quickly. They can come right into the system, identify who their student was close with. Perhaps they were, on a field trip with Dr. Jones's class, and then they were also, had lunch with Cindy Brady, and afterwards, hung out with Mick Jones. And that information can then be submitted to an administrator. One of the things we want to emphasize here is that this process is completely confidential. While an administrator will know who submitted the report, the people that are reviewing this information it's emphasized to them they cannot disclose the parent or the student or any of the situations around this. We don't want any stigmatism attached to the family or their students, no retaliation. This is just purely a matter of protecting the environment by getting in contact when these folks that are identified or contact that are not told who reported them. They're just known that they may have been exposed and should self-quarantine and get with a medical provider. So when you fill this out, the parent would put in their name, the date that they've completed this report, and when that's submitted, that is going off immediately to an administrator. Meanwhile, we're emphasizing to the family that their health is a top priority. We are recommending that they follow up with a medical provider. In the next step, we have them get this form. It's a medical provider release. In some instances, let's say that they were in close contact or they have a symptom, they may not actually have COVID-19. And so rather than having to sit out a long quarantine period, if a medical provider clears them, they take this form, a doctor completes it or provides a different kind of note, they can come back to the system and provide some basic details of that information. So we ask them to provide key fields off the form and then also attach a photograph or scan of that document. This allows us to rapidly get that to an administrator for approval to get them returned as fast as possible. So I'm just going to enter that information real quick here. Once I've entered that, I'll click Next. On this next screen is the opportunity for me, if I'm on a desktop, I can add a scanned image. If I'm on my mobile device, I can take a picture and upload it directly. It gets attached. Once I've attached everything I need, I click Next, and that has been forwarded to the administrator. Administrator is then going to be able to clear that, and as soon as they have, then I'm ready to just get back to school, and then the next day repeat that tracking process as well. Let's jump over, and I want to show you briefly what the staff version looks like. Now, as with the parent-student version, we similarly have a document here for the employee side. Same kind of things, capturing the consent from the employee, the symptom screening, if a symptom detected or positive test, and the contact tracing, directing to a medical provider, uploading that documentation, then them going into a waiting while administrator approves that, and then return to work, of course. Okay, just want to show you here on the right side, I've got this shrunk down, our document that we're going through. On the left side, it's the exact same platform, but oriented differently for a different type of user, in this case, the employee or staff. Having a branding logo up in the top left, and then different tabs here on the left column. This particular example shows a program where the COVID-19 program is part of a larger benefit administrative plan, and that this organization is using it for their open enrollment and their voluntary benefits and their health and wellness programs, their HRA, for showing their employees their claims and RX history and all the things that come up in a benefits environment, and then seamlessly integrated are the actions around mitigating and stemming the spread of COVID-19. And so an employee who's here can be going into their messages and activities and seeing that they need to complete this workflow for stemming the spread of COVID-19. And just as with the parent-student version, same kind of thing, introductory information to meet the moment and protect the shared spaces, created using CDC guidelines. They'll come in, look at that same type of COVID release, again customized for this particular whatever the employer is, and the details for the employee and their employer, and the specifics of what their program entails, so they can see that, and that whenever they complete that, they are just same kind of attestation, and then that is captured and stored, and then they're off to their symptom screener. And from here, it's just like in the parent-student version. Of course, this is the employee or staff member doing this for themselves. And so they'll be coming along, and whether they do or don't have symptoms, completing this attestation. And once they've done that each day, provided they don't have symptoms, it's completed and they're ready to go on their way, and then they'll return here each day. So let's jump back to where we were at. That's an overview of the core of this. Again, we're going to recommend that you get back with your advisor, who can then start to talk about how specifically to use this in your organization. You can provide additional details as necessary. If you do not have an advisor, please email us. Don't hesitate to email us at actnow@hciactive.com, and we look forward to connecting with you soon. Once again, thank you very much for attending this presentation, and have a great day.